Imagine walking into a hospital where your diagnosis doesn't come from a doctor, but from an algorithm. Artificial intelligence is transforming healthcare faster than ever before, and in some cases, it's already outperforming human doctors. But is this the future of medicine, or the beginning of something far more unsettling? In the last decade, AI has gone from a niche research tool to a critical part of modern medicine. Companies like Google DeepMind, Path AI, and IBM Watson Health are creating algorithms that can read X-rays, CT scans, and medical records faster, and in some cases more accurately, than trained specialists. AI isn't just about speed. It can detect subtle patterns that even experienced doctors might miss. For example, DeepMind's system achieved accuracy levels that rival world-leading ophthalmologists in diagnosing eye diseases. At Moorfields Eye Hospital in London, doctors are already working alongside this AI to improve care for real patients. This isn't science fiction. It's happening right now. One of the most dramatic breakthroughs has been in medical imaging. AI models are now diagnosing cancers, heart disease, and even predicting strokes before symptoms appear. In 2019, a study published in Nature Medicine showed that an AI system outperformed 6 radiologists in detecting breast cancer. Another tool developed at Stanford University identified pneumonia on chest X-rays more accurately than human experts. At the Mayo Clinic, researchers are testing AI that analyzes heart scans to detect subtle signs of heart disease years before symptoms show. And at the Cleveland Clinic, AI is being used in pathology labs to scan biopsy samples at incredible speed, helping doctors confirm cancer diagnoses much faster. Think about that for a moment. For decades, a patient might wait anxiously for days, sometimes weeks, to get test results back. AI is shrinking that timeline to hours, sometimes even minutes. And it doesn't stop at physical scans. In psychiatry, natural language AI is screening for depression and anxiety. By analyzing tone of voice, pauses in speech, and even word choice, it can flag risks earlier than a clinician might. Imagine an app that could quietly signal a mental health crisis before it reaches breaking point. In real-world hospitals, AI is already helping to triage patients, predict complications, and even recommend treatments. For patients, this means faster diagnoses, fewer errors, and potentially life-saving early interventions. But for doctors, it raises an uncomfortable question. If a machine can outperform them in certain tasks, what's left for the human doctor to do? Now, does this mean AI will replace doctors entirely? Not quite. At least, not yet. Most experts believe the future is about collaboration. Doctors bring context, empathy, and the ability to interpret complex human situations. AI brings raw computational power and the ability to analyze millions of data points in seconds. Think of it like flying a modern airplane. Autopilot systems can handle most of the flight, but when turbulence hits or an emergency strikes, you still want a human pilot in the cockpit. The best outcomes so far come when doctors and AI work together, a concept known as augmented intelligence. In these cases, error rates drop, and patients benefit from both human judgment and machine precision. But here's the catch. AI in medicine faces massive challenges. First, data bias. If an AI is trained mostly on data from one population, it may fail on others. For example, an AI trained mainly on Western patient data might misdiagnose conditions in African or Asian populations. That could mean dangerous mistakes. Second, accountability. If an AI makes a mistake, who's responsible? The hospital? The doctor? The tech company? Right now, the law has no clear answers. Third, trust. Would you trust an algorithm with your life, even if it's statistically more accurate? Surveys show most patients still hesitate. In fact, a 2023 Pew Research study found that more than 60% of patients said they'd be uncomfortable with AI playing a major role in their care. And then there's privacy. AI systems rely on massive data sets, but medical data is among the most sensitive information we have. Who owns that data? And can patients be sure it won't be misused? Despite these challenges, the future looks inevitable. AI will become a standard tool in hospitals, clinics, and even in your pocket. Imagine smartphone apps that diagnose conditions from a photo, or wearable devices that predict illnesses before they happen. Apple, Fitbit, and other companies are already working on algorithms that can spot irregular heartbeats, drops in blood oxygen, even early warning signs of strokes. Experts predict that by 2030, AI could be involved in over half of all medical decisions. But the bigger question isn't just whether AI can outperform doctors. It's whether healthcare will remain human-centered or shift toward machine-driven systems, where doctors are assistants to the AI. So, what do you think? Would you trust an AI to diagnose you? Or would you still prefer a human doctor? Drop your thoughts in the comments. And if you found this breakdown useful, hit the like button, subscribe, and join us here on AI Unlocked every week, where we explore the future of artificial intelligence and technology.